crisis that states are facing. So we're going to hear from Matt of children. So what we're going to do today, we are going to hear from experts on Medicaid who work on the state level primarily, and are going to educate the staff about the severity of the Medicaid budget crisis that states are facing. So we're going to hear from Matt, where's Matt? Right there. From Matt Salo, the Director of the National Governor's Health and Human Services Committee, and Michael Byrd of the National Conference of State Legislators regarding the severity of the Medicaid budget crisis that states are facing and what federal policies are needed to keep the Medicaid program strong and economically viable. And then Vincent DeMarco, who there is a book. I'm going to plug your book, if you don't mind. It's called The DeMarco Factor, Transforming Public Will into Political Power. He's a former Assistant Attorney General in Maryland and is the president of the Maryland Citizens Health Initiative, a coalition of over 1,000 organizations seeking to ensure quality, affordable health care for all Marylanders. And he is a nationally recognized advocate for universal health care and represents and advocates on behalf of low-income people in the state of Maryland. So what we'd like to do is we can start first with Michael Byrd. And Michael, you're going to share time, I believe, with your colleague, Miss Rachel Morgan. Thanks for coming. And then after they finish, we'll do Q&A. Thank you.
Thank you very much. First of all, let me admit freely that the three Medicaid experts up here are these three people. I'm the big picture guy. I think my role at the National Conference of State Legislatures is to follow the conditions of state budgets, what's going on with state legislatures in terms of trying to really confront, perhaps since the Great Recession, perhaps the greatest fiscal challenges that they've had to face. There were folders over here with handouts in them. If we ran out, we might have it looks like this. If you didn't get one, if you could just give us your card or whatever at the conclusion, and I can get back to you. But for those of you who've got it, I'm working from a chart that's on the right-hand side of the rear of the folder, and this talks about what the budget gap is in the states. Now, just to give you a little history, this started in late fiscal year 2008 in terms of where the states are right now, primarily as a housing downturn. It has grown exponentially since that time into a full-blown recession. And with a full-blown recession comes greater unemployment, greater stress on programs that are designed to help those who are hit hardest by an economic downturn or a recession, a stagnant economy, and with the stagnant economy and all these other factors comes declining revenues. This is what's going on in state capitals across the country and has been going on primarily for the last 2 years. Now, on this chart here, for those of you who've got it, the budget gap, the amount of money that states did not have in fiscal year 09, I'm going to be talking 9, 10, and 11 primarily, was $117 billion. Now, I know in Washington, D.C. terms, maybe $117 billion doesn't sound like an awful lot of money. But that represents almost 18% of the general fund budgets cumulatively of state legislatures and governors' budgets across the country. Or to put it in other words, you almost have to eliminate all defense spending at the federal level and some discretionary spending in order to come up with what was the gap that states had to fill. And the choices are limited as to what can be done. Either you increase revenues, you reduce spending on programs, or you do some combination of the two. And that's pretty much what has been taking place in state capitals since fiscal year 09 started and is continuing through today. The tactics that states have had to use, and this is why, first of all, you've had some program cuts. And you start with the low-hanging fruit, just like you probably would in any policy-making body. That has moved on to administrative efficiencies. It has moved on to the deferral of a number of capital projects. It has grown into furloughs and other things that have stymied the state workforce. It has changed, it has grown further into adjustments and modifications to state pension and retirement contributions, and has sort of culminated in what I call the Shark Tank, which is really a term derived from one of Matt's previous bosses, a guy named Jim Martin. The Shark Tank really, if you take a look at the state budget, and try to take your federal budget hats off, a state budget is comprised almost entirely of money for public health and Medicaid, for human services, for education, both K-12 and higher education, for public safety, law enforcement, homeland security, and transportation. And there's some states that put transportation in a different silo. These 6 big entities, and they're all big ticket entities, some more so than others, are essentially competing with one another right now across the country to see who can dodge the bullet, or who maybe only gets shot once rather than getting shot 5 or 6 times. I mean, really, it's a tremendous strain. It is an incredible challenge for both legislators and governors in order to try to accomplish essentially what they all have to do. At the end of the day, they all have to balance their budgets. To sort of put you right where we are right now, in fiscal year 10, the year that is concluding, legislators and governors had to close a budget gap of about $175 million. Now, if the total general fund budget across the country for all states cumulatively is around 6.25, we're talking almost 30% in cuts. So if you can put into your mind for just a little while, let's eliminate the Medicaid program, let's eliminate the Medicare program, and let's pick up a couple other dollars somewhere else. That's what states are engaged in right now, and that's why this whole issue about perhaps an extension of the Medicaid match that's inside of H.R. 4213. Well, it's not inside there in terms of the House passed version, but it is back over on the Senate side right now, is so critical. The only good fiscal news that states got in fiscal year 9 and 10 was the stimulus money. That's the bottom line. Now, for some, maybe that put off some big decisions, but the thing is, it was the only thing that prevented states from being a very, very counter-cyclical force. I mean, when times get tough and budgets have to be balanced, the state, goes into how do we get through all this? And some of that means that you start stopping doing some of the things you're doing. You don't fill vacancies. You sometimes cut the workforce. And at the same time, though, you are there along with the federal government to serve those who've probably been most harmed, or to deal with those programs where, like Medicaid, where the rolls have grown exponentially in a very, very short and compressed period of time. Now, all the information we have, we 3 times a year do a report on the conditions of state budgets, what individual states have done to help to balance them, what either spending or revenue actions. You are more than welcome to call us or to use the email site that we have to get further information. The governors, I think, just finished another report along with the state budget officers. These reports mirror each other incredibly. We will do the next one. Our next one comes up in July, so that you'll even have a clearer picture of what's going on. In NCSL, which is a bipartisan organization, I think it's important for you to know that we're not even allowed to speak to Congress about any particular issue unless we can get 3/4 of the states to agree to a particular position. Now, that may seem like a very high threshold. It is a very high threshold, but the thing is, what it drives inside our organization is that we get regional, bipartisan, cross-ideological support for positions. And in terms of anything in ARRA that could possibly be extended, there is almost unanimous agreement that the Medicaid assistance is the provision. It's the one thing among all the things that you could possibly extend that there is just very broad, both sides of the aisle, consensus on this issue.